yeah, as you said, this is a work which is based on several years of research. I've been interested in hamstrings for quite a while, and first of all, I would like to show you which are the hamstring muscles, because I know that there is this, like the audience is very diverse. So what you can see here is the hamstring muscles, which are on the back of your thigh. And why the reason why it's very interesting to study these muscles is because we have many hamstring injuries in sprint-based sports. For example, most of the hamstring injuries are in the biceps femoris long head muscle, which is here on the lateral side of the thigh. And we have a lot less injuries, for example, in the semitendinosus muscle. And when I started to read about how hamstrings behave in running when hamstring injuries occur, I noticed that the main function of the hamstring muscles are, first of all, in the early stance phase of running. This is when hamstrings contribute to horizontal force, to propulsion of the body. And we have most of the hamstring injuries in the late swing phase. And what we can see on the top curves, these are the hip and knee angular displacements, which these are the joints which are crossed by hamstring muscles. And from these, we can calculate the muscle tendon lengths of these muscles. For example, here we have biceps femoris and semitendinosus. And we can notice that in this phase of the running cycle, these muscles are very, very long. Okay, so we have long muscle length. And on the bottom, what we can see is that the EMG activity of the muscle, which is basically the activation of the muscle, is also the highest in this phase. So we have a very long muscle length and we have high muscle activation. So in the first part of this presentation, I would like to show you why it's important to understand muscle length, and then why muscle activation is important from a hamstring injury perspective. And maybe it seems like we have many studies on this and we know everything about how hamstrings work, but hopefully you will say at the end of the presentation that we have lots of things that we actually don't know about hamstring muscle function in sprinting. And in the second part of the presentation, I will try to link hamstring exercises that are typically used to prevent injuries to muscle function in sprinting. So let's start with sprinting and in particular muscle length. So what we can see on this figure is the length of the whole muscle tendon unit. Now, if we go back in time to 1993, this is one of the first studies which showed that the magnitude of muscle fiber strain is a good predictor of strain injury. So here's the first discrepancy. What we can see in most of the studies on human are length change of the whole muscle tendon unit. And here, in vitro studies talk about the length change of the muscle fibers. So it would be very interesting from this perspective. It would be very interesting to know what happens in the muscle fiber. The problem is that in humans, we cannot measure the length change of the muscle fibers. So what we tried to do when I started my PhD is to examine the length change of the fascicles, which are basically muscle fibers in a bundle. And there are many studies on other muscles using ultrasonography to track fascicle behavior. So the idea was, if we know how the fascicles behave, we can define who is at high risk of hamstring injuries. So this is how my PhD started, and this is how it ended in approximately 4 months of practice in the lab. And the main reason is that I spent a lot of time in the lab, but it is very difficult to get something valuable out of the ultrasound machine on biceps femoris. And the reason is that biceps femoris is very challenging to measure with ultrasound. It's a very complex muscle. This study, for example, in 2020 showed that even at rest, it's very difficult, very challenging to measure the length of the fascicles. And one reason is that normally we use a single probe, especially in dynamic conditions. And in this case, we cannot see the length of the whole fascicle. This is an extremely short field of view. There are probes which are a little bit longer, but normally with most of the ultrasound probes, ultrasound transducers, we have this limitation that we cannot see the entire fascicle. So we estimate quite a lot of the fascicle length. And another problem was that we also observed some out of plane rotations of the fascicles. So it was very difficult with this two-dimensional method to track the three-dimensional movement of the muscle. So at this point, it's been very challenging to measure fascicle length. So most of the studies focus on measuring the length of the whole muscle tendon unit. And probably from a practical perspective, it's very interesting to see that there are many artificial intelligence-based methods coming out, where based on video images, we can actually define the position of different segments, and then we can estimate the length change of the muscle tendon unit. So this is an example from our project from France, which this is a software that's being developed, but there are many others available. The problem with this approach, of course, is that it's very likely that there is a decoupling between muscle and tendon. So what we can see here on the top is the length change of the muscle tendon unit in the swing phase of the running cycle. And we can see here that some of the length change is actually in the tendon, and the rest is in the muscle. So there is difference between muscle tendon length change and length change in the actual muscle. And this simulation study showed that if we change the stiffness of the tendon, then it will affect the length change of the muscle. So, for example, if we have a higher tendon stiffness, then it is very likely that we have a higher strain injury risk. Of course, if you're a coach, then you might worry because most of the training intervention will actually increase tendon stiffness. There are some studies on plyometrics showing no change or decrease in tendon stiffness, but most of the training interventions will increase tendon stiffness. But of course, if you do a training intervention, there are also changes in the muscle, not only in the tendon. So it's always very difficult to interpret these simulation results to what happens actually in real life. So muscle tendon length is not always calculated, and we need quite precise measurements of hip joint angle, which is not very easy. The knee joint angle is a little bit more simple to measure. So there is another approach where we use 3D motion analysis. This is a bit more accurate. but of course, it's less ecological. It's more difficult to measure in sports environments. And there are a few prospective studies which found a link between the kinematics of the athlete and hamstring injuries. For example, one study showed that increased anterior pelvic tilt is related to hamstring injuries. And two studies showed that increased lateral flexion to the ipsilateral side is a risk factor. So not many studies, not many prospective studies. And in the recent years, interestingly, we have more focus on anterior pelvic tilt, probably because most of the measurement, like sports on field measurements are in the sagittal plane. They are restricted to the sagittal plane. It's very rare that we analyze the movement in the frontal plane, and there is like theoretical background behind pelvic tilt affecting hamstring injury risk. For example, musculoskeletal modeling and also cadaver studies have shown, and some experimental studies, that if you increase pelvic tilt, but we can see very clearly in the middle, then we also increase the length of the hamstring muscles. So maybe it's related to hamstring injuries. It might be interesting to measure. And what was also interesting and very important, I think, in the recent years, that it's been shown that with training intervention you can actually decrease pelvic tilt. This was a 6-week training intervention. So they could decrease pelvic tilt in the late swing phase. And what they also observed is that this was uh, accompanied with a simultaneous change in the thigh angle. So the authors thought that, okay, so maybe pelvic tilt and thigh angle are related. So why don't we just measure a thigh angle? I don't know if you notice, but we started with muscle fibers, what happens at the level of muscle fibers. And now we are thinking about measuring the angle of the thigh relative to a horizontal line. I will get back to this thigh angle. I also try to give you some different methods to measure these, for example, pelvic tilt. So this was still 3D motion capture, which is also still very difficult in sports environments. So we talked about artificial intelligence based like video analysis. And there is another option if we want to go more simple, is inertial measurement units. And it seems to be valid for the measurement of pelvic tilt. And if you're interested in this topic, there will be a study coming out very soon about IMUs used to track pelvic tilt and relating this to hamstring injuries. So I'm coming back to the thigh angle now. So this was a recent study, which is very cool. They had 161 professional male football players, and of course, there are many different risk factors for hamstring injuries, which they tried to take into account. And they also measured, they called it lumbopelvic control, where they designed this so-called kickback score based on the idea that pelvic tilt and thigh angle may be related. So here what you can see is that at different positions, they measure the angle of the thigh. And this is basically, they sum these two angles at toe off and touchdown, and then they they say that if you have a lower score, then you are at higher risk. If you have a higher score, that you are at lower risk to sustain hamstring injury. The problem was that in the end, this was a prospective study. This was not a risk factor for hamstring injuries in their study. So we have one study saying, one perspective that from previous studies that it's a risk factor, and now we have one which is saying that it's not a risk factor. But the big difference is that one measured pelvic tilt directly and this one measures thigh angle. So what we tried to do is to validate kickback score, and we had some football players sprinting over ground. We calculated the kickback score from the thigh angle, and we also measured pelvic tilt based on the videos. So we also put some markers on the leg, so we could have a more accurate measurement of the pelvic tilt than using as compared to not using markers. And we also used 3D motion capture. So this is the gold standard to measure pelvic tilt if you don't use bone pins. And what we found was that unfortunately thigh angle was not related to the pelvic tilt measured by the 3D motion capture. But it seemed to be quite accurate to use the 2D method to measure pelvic tilt. So it seems that muscle fiber strain predicts hamstring strain injuries, and it's likely related to sprint technique. Assessing pelvic tilt seems to be important from a hamstring injury management perspective, but maybe kickback score is not the best. So don't rely on thigh angle. That's my suggestion at this point. And suggested methods for data collection on pelvic tilt in sprinting includes 3D and 2D marker-based methods, or IMU, at least in the swing phase, which is the most interesting from a hamstring injury perspective. It seems to be a valid method. So now I will go from the mechanics of the muscle to the excitation of the muscle, the activation of the muscle. Second part of this running part of my presentation. So what we need to notice is that that muscles work in a very complex system. So especially the muscles in the lumbopelvic region have a large potential to influence the length of the biceps femoris muscle. Here we can see on this figure different muscles. If you have more activation in the muscles on the left, then you can decrease the length of the biceps femoris. If it's on the right side, then you actually increase the length of the biceps femoris. So it seems that the coordination between these muscles are very important to examine. So again, there are not many studies. This is one of the few studies, which was a prospective study where they put different electrodes, EMG electrodes. This is electromyography. This is the method to measure muscle activation. So they put electrodes on different muscles around the pelvis. So you had some trunk muscles, glutes, hamstrings, and then they perform maximal sprint accelerations. These were football players. And what they found was that if you had a higher activation in the gluteus maximus muscle or the trunk muscles, then you had a lower hamstring injury. This is aligned with the idea of my previous slide that these muscles may actually decrease the stretch on the biceps femoris muscle. The problem is that this is the only prospective study, and if I take this retrospective study, this shows completely different results. For example, on the gluteus maximus, they found no differences between injured and non-injured legs. But in the biceps femoris muscle, they had a lower activation in the late swing phase in the injured leg compared to the uninjured leg. So at this point, it's very difficult to say what's happening here. EMG is not the only method to measure muscle activation. Another approach is to measure the metabolic activation of the muscle using muscle functional MRI. And this method works like this. So first we have a scan in the MRI. And here we define the transverse relaxation time of the muscle. So basically it's related to metabolic activation. And then we perform several sprints. And then we put the athlete back to the machine and we do another scan. And we see the changes in transverse relaxation time to reflect muscle metabolic activation. And we have very different results again compared to EMG studies. So this study found no difference between recently injured and non-injured legs. However, they also found that within the semitendinosus muscle, they had more heterogeneous activation. So this is the intramuscular activation of the muscle, which was more heterogeneous, but no difference between muscles. So what we also observed in our study was that the distribution of EMG activity was highly individual in running. So this was a different method. This was high density EMG, which I will introduce soon. But basically what we found is that some athletes activated their semitendinosus more. For example, this one in the late swing. Others activated biceps femoris more than semitendinosus. So here we just compared two of the hamstring muscles. And we had some other subjects where, for example, we had very similar activation in the late swing phase between the two muscles. But it was very consistent between running speeds. So the different colors are different running speeds here. So we can see that this was very specific to the individual, which muscle they activated. And this might be important because the synergistic hamstring muscles can also reduce the stretch in the hamstring, in the biceps femoris. So maybe if you have higher semitendinosus activation, it helps to reduce the low biceps femoris. Okay, so about between muscle differences, intermuscular coordination. We have a few studies, we have some theory, but the studies are quite contradictory. What I want to show you is, or what I want to introduce now is the idea to study the activation within the muscle. So if we focus on the biceps femoris specifically where hamstring injuries occur, does it make any sense to understand just the activation of this single muscle? And if we go back to this early study, this is one of the first which show that if you have an increased activation of the muscle, this may be related to decreased strain injury risk. So here we have some muscles which are stimulated with different intensities, and if we have a higher stimulation intensity, then we have a lower stretch in the muscle. So as I mentioned, we had two different methods to measure muscle activation. One was muscle functional MRI, where we have high spatial resolution. So we can see proximal distal differences, we can see the whole muscle, but we have a low temporal resolution. So we cannot separate the activation in different phases of the sprint cycle, for example. On the other hand, what we see in most of the studies is the bipolar EMG, where we have a low spatial resolution. So we cannot see the differences within muscles, but we have high temporal resolution. So we can actually measure what happens in the late swing phase where hamstring injuries typically occur. And the interesting thing is that we have a method where we can actually combine the advantages of these two methods. This is called high density EMG, and this is what we started to use in running. And this time we did this study on a treadmill, and we can see here that the activation is in the late swing phase, and in this example we have the highest activation in the distal region of the muscle, for example. So this is an approach that we tried to use. At this point, we just measured on non-injured individuals. So we have no idea if this is actually related to hamstring injuries, but we actually found some regional differences in running, which was also highly individual. And what's also really cool is that recent technological developments allow to measure high density EMG in overground sprinting. And this is so if you measure the activation on treadmill, then one limitation is that you measure at a constant speed normally, and you cannot measure at maximum speed. And basically what we did is we measured on the right side in our study up to 75% of maximum running speed, and we didn't really see a shift in the regional activation of the muscle. So at slow speed we have a different pattern to high speed, but actually the high speed was not close to maximum running speed. And this recent study, they went to up to 100% of maximum running speed with this new technology, and they actually found some shift in the regional activation of the muscle. So it seems that it's really valuable to measure the activation with high density EMG at maximum running speed compared to submaximal. So this is the system they used. I don't know if you see my screen, but this is my camera. This is a very small system. You can see it also here. So it's completely wireless, so you don't have the common problem with movement artifact. It gives a very high quality signal. So what's interesting is that you can see here that the activation of the muscle is higher in the distal region as compared to the proximal region of the muscle. And most of the hamstring injuries are actually in the proximal region of the muscle. And we also have some simulation studies from 10 years ago where they showed that the strain distribution at the very beginning of the presentation, we were talking about fiber strain, if you remember, and we had in this study the highest strain in the proximal region of the muscle. So, and this is at the bottom, you can see that this is sprint speed. So, especially at maximum velocity sprinting, we had a very high strain in the proximal compared to the distal region. But this simulation is purely based on the shape of the muscle, basically, and they assume that the activation of the muscle is homogeneous. So, as I mentioned, we had some in vitro studies showing that the activation of the muscle actually affects how much strain you have in the muscle. So probably the regional distribution of the muscle can actually change this pattern and make some people more vulnerable to hamstring injuries than others. So examining muscle activation seems to be important, but the results on sprinting and hamstring injuries are contradictory. At maximum running speed, regional differences in EMG activity within the biceps femoris are amplified, which may increase the vulnerability of the proximal muscle region to strain injury. And EMG patterns are highly individual, and we don't know if they really reflect of the neural input to the muscle. So this is a limitation that I didn't mention, is that we are still measuring amplitudes of the muscle. And this is also affected by external factors, not necessarily the neural input to the muscle. So one way to go from here is to actually examine the motor unit behavior. And state-of-the-art high-density EMG techniques provide the opportunity to collect high-quality, spatially and temporally robust data in highly dynamic movements. So in the second part of my presentation, it might be a bit overwhelming, too much information, but I promise you that the second part will be a lot shorter and try to simplify it. But I also found it important to actually understand the mechanism, the biomechanical basis of hamstring injuries, to understand how these are related to the hamstring exercises we typically apply to prevent injuries. So we have some exercise interventions which have been shown to reduce hamstring injuries. One example is Nordic hamstring exercise. We have most of the studies on Nordic hamstring exercise. And we have some studies, this is especially the Askling protocol, where these are two different approaches, basically, because first we have short muscle length, relatively short muscle length, but we have a high load on the hamstrings, and here high activation. And on the bottom, we have these long length exercises where the muscles are not very highly activated, but we have a long muscle length. And these both look, in some scenarios, they look quite effective for the prevention of hamstring injuries. So what we wanted to see is basically with this high density EMG that we started to use, we wanted to see if we have differences between different exercises in terms of how the hamstring muscles are activated. And basically, what was very interesting to see is, of course, if we had different exercises, the overall activation of the muscle could be changed quite a lot. This is not a novel information. We know this from bipolar EMG studies. And for example, these are two muscles here, semitendinosus and biceps femoris long head. It was a bit more challenging to activate only one of these muscles. So muscle-specific activity was relatively more challenging to have. And what was interesting to see is that for the exercises where we had a long muscle length, we also had a relatively low EMG activity. And when we had a very short muscle length, then we had a very high EMG activity. This is interesting because, for example, in sprinting, we had long muscle length and high EMG activity. And what was a novel part of this study is to use this high density EMG where we compared different regions of the muscle. What we can see here is for example, proximal, middle, and distal region with different colors. And on the top, we can see the concentric phase, and on the bottom, we can see the eccentric phase of different exercises. It doesn't really matter which exercise is which at this point, because what I want to point out is that we had regional differences in most of these exercises, 6 out of 9 exercises. And for most of these, we had the lowest activation in the proximal region of the muscle. And if you remember, this is where most hamstring injuries occur, in the proximal region. So it's still a question if it's related to hamstring injuries. Is it the case that maybe we cannot prepare this region for the high demands of sprint running because we are not activating this region much? We don't know. Maybe it's a good thing because there are studies showing that if you have a relatively large volume in the proximal region, muscle volume, compared to the aponeurosis of the muscle, the volume of the aponeurosis, then it increases the risk to sustain a hamstring injury. So we just observed that we have a lower activation in the proximal region, but we don't actually know if it's a good thing or a bad thing. So as I mentioned, in these different exercise protocols, which seem to be effective, maybe that we have two different mechanisms, because in the first one, we have high muscle activation at short muscle length. And in these bottom exercises, we have a low activation at long muscle length. And our question was that can we actually combine these and have high muscle activation and long muscle length, similar to what we observe in running, in high-speed running or sprinting. So we designed one study where we compared Nordic hamstring exercise on the left. This was a good starting point because this can reduce many of the hamstring injuries. And we did the same. We matched the load between exercises. So it was eccentric 1 repetition maximum. And we performed Nordic hamstrings with flexed hips. So we had 90 degrees hip flexion. So we actually stretched the muscle to a long muscle length. And we measured the force at the ankles. And what we observed was that we had in this exercise, when we flexed the hip, we had a much higher peak torque. However, what was interesting is that the activation was still higher in the traditional Nordic hamstring exercise, which might actually reflect a different mechanics of the muscle between these two exercises. So we don't know if the eccentric component is actually larger in the flexed hip position, but we have a few studies showing that in most of the Nordic hamstring exercise, at the fascicle level, or muscle fiber, muscle fascicle level, we have mostly an isometric contraction. We have most of the elongation in the tendon, and the eccentric part comes only at the end of the movement. And when basically the subject the athlete cannot hold himself and falls. Here we don't have this phase actually, because we adjusted the load to the strength level of the athlete. So maybe there is no eccentric phase here. It's not very clear. But maybe when we flex the hip, it's probably because of the longer muscle length, we have more eccentric phase in the muscle fibers. This is something that we try to figure out in the future, but we don't have data on this at this point. Of course, EMG amplitude alone is not sufficient to understand muscle adaptations. There are lots of other factors in playing a role. So we need to think about complex understanding of muscle EMG activity, but also the mechanics of the muscle to understand muscle adaptations. So at long muscle length, it seems to be challenging to achieve high muscle excitation or activation during typical hamstring exercises. Nordic hamstring exercise with flexed hips may be optimal to achieve high force at long muscle length, and its efficacy for injury prevention should be further examined. In most exercises, EMG activity is typically lowest in the proximal region of the biceps femoris, and this is where most hamstring injuries seem to occur. And I just want to finish with some of the future directions where we try to go using these new methodologies. So in terms of muscle excitation, what we really miss is the link between the neural input and the activation of the muscle. So we have to acknowledge that even though we see regional differences in the amplitude of the EMG activity, this is also influenced by other factors than the neural input to the muscle. So we have some very promising results from our collaborators from Italy, where they actually proved that our approach was valid, and the neural input can also be region specific, and it's highly dependent on the individuals, but we don't know if it's actually related to hamstring injuries. So this is one direction we try to go. And we continue using these robust high-density EMG systems in highly ecological movements, so in sprinting, and relate the EMG activity patterns to hamstring injuries, because most of the studies try to understand hamstring muscle function in healthy individuals, but there are very few studies where it's actually measured in relation to hamstring injuries. And as I said, it's very, very difficult to measure fascicle behavior of the biceps femoris. But again, with some from the University of Verona, Andrea Monte has some very promising pilot results. Because since I started my PhD almost 10 years ago, we had huge technological developments also on this part. So now we have some very small ultrasound devices which are portable, and you can connect two transducers simultaneously. So we can actually record from a quite large region of the muscle at very high frame rate. So I think there is still hope that we can understand the mechanics of the biceps femoris in relation to hamstring injuries in the future. And of course, it's going to be interesting and important to understand how muscle excitation and muscle mechanics are related. Thank you for your attention.